Good morning, Mr. Green. Good morning. Mr. Green, good morning. My name's Sandy. I'm the nurse for you this morning.
Who are you?
Can you tell me your name?
Norman.
Norman. Norman, what's your last name?
Green, Norman Green. Where am I?
This is Greenwood, the nursing home. You came here 4 days ago from the hospital. Do you remember? Are you having any trouble breathing here? You look like you're having trouble breathing.
A little bit.
I'm gonna put some oxygen on you, all right? Okay.
Who are you?
My name's Sandy. I'm the nurse for you this morning. Okay, I'm gonna listen to your lungs here, okay?
Okay.
Okay, Mr. Green, you're having a little trouble breathing there. We're gonna put the oxygen on. I'm gonna go call the charge nurse and we're gonna try to make you feel better, okay? I'll be back in a few minutes, all right?
Okay. Where am I? Where am I?
This is Mr. Green. He came in from the hospital 4 days ago with exacerbation of CHF. This morning he's really confused. He knows his name, doesn't know where he's at.
Okay.
Keeps asking me who I am, even with reorientation.
Right.
He's a little tachycardic. His blood pressure's low. Put him on O2. His stats were 89% when I put him on, and he came up to 95%.
Okay, so he did get better.
Yeah, and he had a 3-pound week in the last 3 days. I think he
Okay.
needs to be reassessed.
All right, thank you. I'll take a look. Good morning, Mr. Green. My name's Brendan. How are you feeling?
I don't know. I don't know how I'm feeling. Okay, I guess. I don't know.
Well, I'll tell you what, how about I put the head of your bed up here so you can breathe a little easier. Does moving around like that make it more difficult?
A little bit.
Sounds like it.
A little bit.
Okay. You know what, I'm just gonna take a listen to your lungs right now.
Good morning. Hey, Mr. Green, how are you? Brendan, I was at the nurse's station and they said that you were having some issues with Mr. Green. What's going on?
Yeah, hi, Dr. Smith. This is Norman Green.
Okay.
He, this morning he had a change in mental status and respiratory status.
Mm-hmm.
So a little bit of background about him. He came to us 4 days ago from an acute care setting, and he was there for congestive heart failure exacerbation. He has no known drug allergies, but his vital signs this morning were 92 over 64 for blood pressure. Pulse was 102, and I heard a new S3 sound.
Okay.
His respiratory rate is 26, temperature 98.9.
Okay.
Weight is 145, and that's 3 pounds more than 2 days ago. His oxygen sats before we put him on 2 liters of Nasacania were 89%.
Mm-hmm.
Now he's up to 95%, and he seems to be orienting better.
Okay.
So basically, he's had increased confusion starting this morning. He definitely needs more help with his ADLs.
Mm-hmm.
Shortness of breath, I heard with you can see the shortness of breath.
Yes.
And crackles in the bases. Whenever he's moving around, he's more labored breathing.
Mm-hmm.
Nothing to do with GI. GU, he has decreased urine output, and there's new onset of incontinence. His intake and output for the past 24 hours is plus 800, and his edema is up to plus 2 now.
All right.
He doesn't have any lab results or anything yet. He doesn't have a DNR. But I think this is just an exacerbation of his congestive heart failure. Maybe it's something to do with his Lasix. He's only on 20 milligrams of Lasix, so maybe we could bump that up, get a chest x-ray, and maybe some more lab work.
I agree. I think that's a wonderful idea. Mr. Green, are you having some problems breathing today?
Yes, I am.
Yes, okay. I'm Dr. Smith, and I'm going to be looking over you today. One of the things we're concerned about is that your congestive heart failure, or that fluid in your lungs, is worsening. And we need to do some things. We're going to get some blood work. It looks like I'm going to need to review your medications and see if there's any medications we can do to help you. And get maybe a chest x-ray and see what's going on with those lungs, okay?
Okay. Who are you?
I'm Dr. Smith. I'm going to be in your care today. I'm going to be taking care of you, yes.
Smith.
Yes, sir. Okay?
Okay.
Wait, Brendan, I'm going to go to the nurse's station. I'm going to write some orders. I agree. Let's get a chest x-ray today.
Okay.
Let's get some lab work, and I'll write up for the some basic lab work
Okay.
coming on. I definitely want to take a look at his electrolytes, Chem 7, Chem 11. I don't know. I have to
Okay.
take a look and see what medications he's on. I'll review that.
All
I
right.
definitely agree about the Lasix. I think we can definitely bump that up too.
All right.
But let me go out. I'll take a look at that. I will be here today. So whatever happens, I want the results phoned to me immediately if possible.
Okay, I
I'll
can
make
do that.
everything stat. All right.
Thank
Any
you.
other questions or concerns?
No, not right now.
All right. Don't worry. Mr. Green, we need to do some things with you. I will keep you posted on what we're going to do and what is happening. Okay?
Okay.
All right. Thank you.
Okay.
All right. Thanks. I appreciate it.
You're welcome.
Good job.